Let me go now to a question, and I have so many, Dr. G, and they're fantastic. But I want to take this one from Malika. She has a good question here that I just got in. There are common side effects to the vaccine, but which side effects should be reported immediately? Thank you, Malika, for that. Dr. G?
So great question, Malika, right? The number one thing we worry about with any vaccine actually is something called anaphylaxis. What is anaphylaxis? It's a big word for symptoms that are really straightforward, which means you get short of breath, you have difficulty breathing, your tongue might get swollen, you might pass out because your blood pressure could drop. So a really dramatic reaction is the kind of reaction that you want to report. Death also, again, there have been reported deaths. Whether or not it's related to the vaccine, if it happened after the vaccine, that is a reportable event. So anaphylaxis, again, that dramatic reaction that causes you to stop in your tracks, stop breathing, and should there ever be a death, that's very important. The typical vaccine symptoms of having a sore arm, I'm sure, Olga, you had a sore arm after you got your vaccine.
I did.
Fevers, chills, this is really normal. So that just means your immune system is working.
Right.
It hurts. It does hurt, right? Mine hurts too.
It does. It does. And full disclosure, 24 hours, I was out of commission, but then it was gone. So that's good. But I've told everybody, don't be alarmed. 24 hours later, I was really out of commission for a while. I have
and so much better than getting the virus, right? Which just doesn't have that bounce back, right? So much better than getting an infection. So that's really why we're talking about everything we're talking about today.
I have a question here from Bob, and I think this is an important one. Let's see if we can take this one from Bob. There it is. I am on chemotherapy. As a result, my immune system is severely compromised. Are there any trials underway to determine if the vaccine is effective in people whose immune system is severely compromised? And Bob, I hope you get better very, very soon. Dr. G?
Sure. So first of all, Bob, thanks so much for that question. I think there are a lot of folks out there. I know in rheumatology, I see this all the time with folks who are immunocompromised, which means, again, their immune system is not at 100% for a variety of reasons. And the reality is we don't have any published data on immunocompromised patients getting the vaccine. That said, like we've been talking about, right, there are things that we know, there are things that we don't know. What we know is if you're immunocompromised, you're more at risk for any infection, especially COVID-19. You're more likely to have higher mortality, which means possible death from the infection, more likely to be in the hospital, more likely to be in the ICU requiring a breathing machine. So when docs look at that risk and benefit, we clearly see the benefit of getting vaccinated. Now, that said, if you're on chemotherapy and you do have a diagnosis of cancer or a really rare autoimmune disease like I deal with my patients, you want to make sure you're making this decision with your doctor, because there could be certain times where it makes sense to get vaccinated and certain times you want to avoid. So typically adjusting chemotherapy schedules, making sure the day of chemo or the day before you're not getting vaccinated. So those are the kinds of things you want to work out. The exact algorithm, the exact timing of when you get the vaccine is really going to be more the question that your oncologist will discuss with you.
Thank you, Dr. G. Doctor, we've had a lot of people talk about swollen lymph nodes in the underarm area in the past, and many women get very concerned about that. And I understand because they're concerned about breast cancer, right? You feel something, you get alarmed. How can you know the difference between a reaction to the vaccine, let's say, and something more serious?
So, that's a terrific question. We've almost done such good education on breast cancer awareness that's, what women are concerned about, because we know that's a red flag for possible breast cancer is a swollen lymph node. So what you want to be mindful of as far as the vaccine, a reaction versus a concern over a possible breast cancer diagnosis is really the acuity of it, right? If you just got vaccinated and then all of a sudden the next day or subsequently thereafter, shortly after, you see that reaction, it could be a possible reaction from the vaccine. But again, this is really something that if that's what you experience, that's something you really want to go to the doctor for, get a full evaluation and make sure you understand what's going on. But I'm glad that our audience is so well read. What a terrific question.
It is. And it's always great to just make sure and cross your T's and dot your I's and go to the doctor. And you know what? Peace of mind. Peace of mind is huge. Okay, next question we have from Susan. Let's take her question and read it. Some researchers are concerned about the vaccine's effect 6 to 12 months out for those that have been vaccinated. Could they have greatly reduced immunity? What is your take on this, doctor?
So, here's the reality. Again, there's a lot we know, there's a lot we don't know. Remember, we just started vaccinating folks a few months ago. So to project what is going to happen in 6 to 12 months, we have to study that, right? We need information to know definitively whether there's any change in immunity. I suspect we'll need a booster at some point, not sure exactly when that is. That is, again, what CDC is telling us at this moment and based on the data at hand. But this is too new for us to really be able to tell the future. I wish I could, certainly. And the way I look at this, and when we think about this, right, because really the question a patient is trying to decide or a consumer is trying to decide is whether it's worth getting the vaccine. My answer is unanimously yes. Think about this as a pair of shoes, right? Just like you wear shoes to protect your feet.
So let's take June's question up and show you the question right now. If we have to get the vaccine routinely, can they combine it with other annual vaccines like the flu shot? Here's a related question as well. How long between the COVID vaccine and other recommended vaccines like pneumonia and shingles should you wait? Oh my gosh, I have been telling myself I'm going to get the shingle shot and I haven't yet. I need to get that shot, and I want you to tell our viewers why they should too. Lots of questions here now. Go for it, Dr. G.
You got it. So first of all, I really admire June. She's thinking ahead. So she's ahead of the pack, and she's also a very efficient lady. I can tell she wants to do the 2-for-1 vaccine, which is great thinking. You know, maybe down the line, right? We're not there yet. Again, this is all so new. And, you know, the danger we have if we start combining COVID-19 with other vaccines is we're still studying it. We're still studying it in pregnant patients, immunocompromised patients. We're still learning. If we start combining it with other vaccines, we won't know what's what, right? We won't know if it was A or B. So I don't project that we likely will have a combined vaccine anytime recently, because it's just the way we're going to study it. We want to isolate it. That said, many years from now, certainly if we can do combination vaccines, we always try to. It's more efficient for many reasons, right? Because now we're going to have to get the flu shot, we're going to have to get the COVID vaccine, and it essentially puts our whole community more at risk. But if we can do it all in one shot, that's definitely the goal. We're firefighting, right? We're putting out the fire. We're not really looking downstream that much right now. We're just trying to get through the pandemic at this moment. But terrific question. And as far as when you should get the shingles vaccine, it is right now, Olga, right? So don't delay. Prevention is always the way to go, whether it's COVID-19 or something else. But the CDC recommends 14 days. So if you just got vaccinated on May 1st, or you're just getting vaccinated on May 1st, you want to wait till about May 15th till you think about getting any other vaccine. And it's for the same reason. It's because we don't know, frankly, we don't have a lot of data here, and we want to make sure that if you have a reaction, we know very clearly that it came from the COVID-19 vaccine or not.
I have a question here from Ivan that I want to get to before we run out of time. Let's see if we can take it. There it is. What is the risk of transmission of the virus from those who have been vaccinated to unvaccinated individuals? Good question, Ivan. Dr. G, your thoughts?
So Ivan, great question. I just had a patient ask me this last week. So again, the answer is small but possible. So this individual that's been vaccinated has a lower chance of getting infected, but they absolutely can be a carrier, and that unvaccinated person that they're hanging out with is completely exposed. They got no shoes on, just bare feet, right? The chances they're going to step on a nail are much higher than that person who's wearing the shoes, aka the vaccine. So CDC guidance right now, vaccinated folks should hang out with vaccinated folks, and it is okay to start relaxing measures in that population. But if you are unvaccinated, you really need to get vaccinated. But mixing that group does not give you any kind of protection if you are unvaccinated. So please, please, please consider getting those shoes. Olga and I will be happy to take you out.